Keratoconus is the thinning of the cornea, the clear dome-shaped outer surface of your eye. Eventually, the cornea bulges outward into a cone shape, causing blurred vision, sensitivity to light, and difficulty seeing at night. Most commonly affecting individuals between the ages of 10 to 25. The chance of developing it increases if it runs in the family. Different treatment options are available depending on the severity. Mild to moderate keratoconus may be treated with eyeglasses or contact lenses. Another treatment is called corneal collagen cross-linking, which uses riboflavin and UV light to strengthen the cornea. Often this treatment is used in addition to the insertion of Intacs. Intacs corneal implants are two small crescent-shaped pieces made of plastic polymer, which are inserted into the cornea to support the cornea's shape, leading to improved vision. But if the cornea becomes scarred, making it painful to wear contacts, surgery is another option. Recovery time can take up to 1 year, and you may need to continue wearing rigid contacts to ensure clear vision. Keratoconus can worsen over time, so early detection is key. If you notice any of the symptoms, it is best to schedule an appointment with your eye care professional. He or she can work with you to make sure you have the best vision possible. If you have keratoconus, a condition where your cornea thins and gradually bulges outward into a cone shape, there are a number of treatments available. Mild to moderate keratoconus is typically treated with eyeglasses or a variety of contact lenses. As the shape of your cornea changes over time, these lenses may need to be updated with a new prescription. For most people, their cornea will become stable after a few years, decreasing the likelihood of severe vision problems or the need for further treatment. In most severe cases, surgery may be required. Your eye care professional will recommend the procedure that's right for you. Options may include the insertion of small plastic inserts called Intacs, corneal cross-linking, or even a full cornea transplant called keratoplasty. It is important to monitor the progress of keratoconus with regular checkups. Your eye care professional will work with you to ensure you receive the right treatment for your condition, giving you the best vision possible.
Intacs são anéis de plástico finos, transparentes, semicirculares para serem inseridos que podem criar uma visão mais clara para as pessoas que têm problemas de visão devido a uma condição chamada ceratocone. Esses anéis são uma alternativa singular para as lentes de contato e podem às vezes adiar a necessidade de um transplante de córnea. Os anéis mudam a curvatura da córnea, reduzindo a distorção em forma de cone resultante da ceratocone. A intervenção permite que se dê uma nova forma à córnea sem a remoção de nenhum tecido. Os Intacs são desenhados para serem permanentes, mas podem ser trocados e até removidos se a visão precisar de mudança com o decorrer do tempo. Não se sente a presença dos Intacs e não são mais visíveis do que lentes de contato, não precisando de nenhuma manutenção.
Have you been told your eyes are hard to fit for contact lenses? Have you been unable to tolerate most types of contacts? For patients with irregularly shaped or damaged corneas, or dry eye, scleral lenses can give you sharp, comfortable vision. With a scleral contact lens, the lens goes over the cornea like a typical contact lens, but instead of resting on the cornea, it rests on the white of the eye, called the sclera, which is less sensitive than the cornea. The space between the cornea and the scleral contact lens is filled with a saline solution. This masks the problem of irregularly shaped corneas by submerging the cornea and using the scleral lens as the smooth, clear front surface where light enters the eye. Because these lenses are wide, they tuck under the lid, so it is unlikely to shift around. This, combined with the benefit of having no pressure on the cornea, allows for a more comfortable fit. With proper care, scleral contact lenses can last a long time, ensuring your comfort for some time to come. Our specially trained staff can test and fit you for scleral lenses. Ask us whether you can get crisp, clear vision with scleral lenses today.
The cornea is the clear surface that covers the front of the eye. The cornea is made up of millions of fibers that are linked together to maintain the cornea's shape. Certain conditions, like keratoconus, can weaken the links between these corneal fibers and alter the cornea's shape. This leads to distorted vision that worsens over time. Glasses, contact lenses, and corrective corneal implants are used to compensate for this, but the problem can progress to the point where the cornea must be transplanted to restore useful vision. A corneal transplant is an invasive procedure requiring a lengthy recovery period, lost time from work, and carries a high risk of post-operative complications. Even if successful, the quality of life for corneal transplant recipients is significantly impacted and often requires them to make permanent lifestyle changes. Today, a procedure known as UV cross-linking is a simple, minimally invasive treatment that can stop the progression of keratoconus and similar conditions. While cross-linking cannot reverse the distortion of the cornea, it can prevent further changes. Studies have shown that cross-linking preserves vision and avoids the need for a corneal transplant. The cross-linking procedure begins by administering drops of riboflavin solution to the surface of the cornea. Once the cornea has been saturated with the solution, a small amount of UVA light activates the riboflavin to strengthen and stabilize the weakened links between the corneal fibers. Most patients will not require more than a single treatment. If you or someone you care about suffer from keratoconus or a similar condition, ask your doctor about cross-linking and find out if you are a good candidate for this procedure. The cornea is the clear surface that covers the front of the eye. The cornea is made up of millions of fibers that are linked together to maintain the cornea's shape. Certain conditions, like keratoconus, can weaken the links between these corneal fibers and alter the cornea's shape. This leads to distorted vision that worsens over time. Glasses, contact lenses, and corrective corneal implants are used to compensate for this, but the problem can progress to the point where the cornea must be transplanted to restore useful vision. A corneal transplant is an invasive procedure requiring a lengthy recovery period, lost time from work, and carries a high risk of post-operative complications. Even if successful, the quality of life for corneal transplant recipients is significantly impacted and often requires them to make permanent lifestyle changes. Today, a procedure known as UV cross-linking is a simple, minimally invasive treatment that can stop the progression of keratoconus and similar conditions. While cross-linking cannot reverse the distortion of the cornea, it can prevent further changes. Studies have shown that cross-linking preserves vision and avoids the need for a corneal transplant. The cross-linking procedure begins by administering drops of riboflavin solution to the surface of the cornea. Once the cornea has been saturated with the solution, a small amount of UVA light activates the riboflavin to strengthen and stabilize the weakened links between the corneal fibers. Most patients will not require more than a single treatment. If you or someone you care about suffer from keratoconus or a similar condition, ask your doctor about cross-linking and find out if you are a good candidate for this procedure.
If the cornea becomes damaged, light entering the eye is distorted and causes our vision to appear blurry. There are several ways that the cornea can become damaged. These may include injury, disease, infection, or a previous eye surgery. Sometimes damage to the cornea is mild enough that it may be repaired to restore vision. However, if damage is more severe, a corneal transplant may be necessary. A corneal transplant involves the removal of the central portion of the diseased cornea, which is replaced with a healthy donor cornea. First, you are given eye drops and medication to help you relax. Next, the central damaged part of the cornea is carefully removed from the eye. Finally, the healthy donor cornea is securely sewn into place. Once your cornea transplant is completed, medications are prescribed to help control infection, swelling, and pain, as well as prevent corneal graft rejection. You will also wear a protective eye shield at night, which you should continue to wear until your doctor instructs you to remove it. It is important to follow all instructions given to you by your physician, as this helps bring the fastest visual recovery. Plan to take it easy after the corneal transplant and slowly work your way back to your normal activities. Corneal transplantation surgery has a high success rate, but like any surgery, complications can occur. The most common complication is rejection of the new cornea. This problem can be recognized by increased sensitivity to light and a sudden increase in eye pain. Because rejection of the new donor tissue can take place years after having surgery, it is important to schedule and attend follow-up appointments based on your doctor's instructions, as well as remaining on any post-operative drops prescribed to you by your physician.
Com o tempo, doenças ou ferimentos podem danificar a delicada camada interna da córnea chamada de endotélio. Estes danos podem fazer com que a córnea inche, tornando-se embaçada, causando borramento da visão. No passado, a única opção era o transplante de córnea, que tratava a fina camada endotelial através da remoção da córnea de um paciente em toda a espessura, substituindo-a pela espessura total de uma córnea doadora. Os resultados eram variáveis e a recuperação era lenta, às vezes levando mais de um ano. Hoje em dia, um procedimento conhecido como ceratoplastia endotelial, com dissecação da membrana, oferece melhores resultados ópticos com um tempo de recuperação muito menor. Durante a DSEK, o cirurgião faz uma pequena incisão próxima à borda da córnea. Depois, a fina camada de células defeituosas ou danificadas é removida. Então, uma fina camada de córnea doadora é dobrada e deslocada para a frente do olho. Uma bolha de ar é utilizada para pressionar a nova camada no lugar. Conforme a bolha é absorvida pelo olho em alguns dias, as células permanecem em sua devida posição. Em alguns casos, o novo transplante não se adere ao fundo da córnea, podendo requerer um segundo procedimento para reposicionamento. Uma vez que o transplante está firmemente aderido, o embaçamento corneano desaparece, retornando a boa visão.
Corneal topography is the latest technology to ensure precise analysis of your cornea. It is used for advanced contact lens fittings, refractive surgery, and for diagnosing, monitoring, and treating various eye conditions. The cornea is the clear outer surface window of the eye. It transmits and focuses light into the eye and plays a major role in how you see. Corneal topography creates a 3D map of the curvature of the cornea. Just as the Earth appears to be a perfectly smooth sphere from outer space, the cornea looks like a perfect curve to the naked eye. However, a closer inspection reveals that some parts are steep and others flat. Using corneal topography, your doctor can closely inspect and map the valleys and hills that characterize your cornea's shape. This sort of 3D map allows for the detection of conditions that would be invisible with conventional testing. During the test, rings of light are projected onto the cornea, and measurements are taken of your eye's surface. This test is non-invasive. There are no drops, there is no contact with the eye, and no puff of air to worry about. Your doctor will use the computer-generated map to create a custom, precise treatment for your eye health and vision needs. For example, if a contact lens is too tight, it could constrict normal tear flow, or if too loose, it could cause excessive movement and damage the corneal tissue. Corneal topography helps your eye care professional identify your unique corneal shape and find the best solution for you.